So when I first heard of Sovereign Health and the program that Dr. Sharma had developed, I thought that bringing mindfulness meditation to a program like this would have a profound impact on patients' lives. And that marrying this idea of brain wellness and meditation could really potentially transform people's lives. Now, in any program like this, drug and alcohol program, I want to fundamentally say that the 12 steps is the foundation of a program for transforming your life. And as I was speaking to Mr. Smith, Larry Smith earlier, anytime I've had a conversation with someone in drug and alcohol, they always bring up the serenity prayer. And the first part of the serenity prayer, of course, is, God, give me the serenity to accept the things I cannot change. And I always ask, how do you do that? Those are great words, but how do you go about accepting things you can't change? This may come naturally to some people, but most people, it's you worry. If you can't change it and something's happening, you're going to worry about it. And you're going to worry and worry and worry and worry yourself into oblivion and ulcer or whatever. So the idea is that meditation infuses this idea from the spiritual side up, and it gives it meaning, because you're practicing in the state of meditation a profound state of just surrendering to what is. And that's as simple as it can be. Meditation is the act of surrender. And it's a learned skill. This is not something, we all vary according to how easy it is to learn. We all vary about how easy it is to ride a bike, how easy it is to play the piano. Meditation and this idea of surrender is a learned skill that requires practice. So it isn't like some mystical condition that I can sprinkle gold dust over you or fairy dust, and all of a sudden you're in nirvana or some state of grace. It really is a practice state, and in effect, it is actually a trick. It's a balancing act. And the trick is to balance your brain and allow your consciousness to unfold inside and around what thinking in the brain is doing. And so it is really an idea that requires quietness, of course, and sitting in a state of where there's not a lot of what are supposed distractions, or you may consider them distractions, and then using a center device for the brain. Now, meditations basically all vary according to what you use as a center device. So there are meditations called mantra meditations, which you repeat a word over and over and over to yourself. It can be a word that you make up. Often there are Sanskrit words, or words you don't understand, or just syllabic sounds that you're repeating to yourself over and over. You can use guided imagery to put yourself in a state where you're imaging this state of serenity and grace and a pleasant sensation, and you literally feel the wind on your face. You smell the smells that you would smell. You put all of your senses into this whatever state of being comfortable. There are meditations of focusing on flames. There are meditations of listening to the sound of high-pitched bells or ringing. There's a meditation on what's called a Zen bowl bell, which is a very highly honed bell that is tapped and then pitch goes up and then it comes down. And you're sitting and listening to that creates kind of a meditative state of just surrendering to the sound. Well, mindfulness meditation is probably the simplest of all meditations and the most available to anybody. Now, I don't know where all of you are in terms of your concepts of meditation and what this is, but I just on a very simplistic level want to say that if you compare meditation to prayer, prayer would be the act of talking to God. Okay? Meditation would be the act of listening. And listening to whatever. It doesn't necessarily mean God, and I don't want to put God out there. That word is too big to try and infuse with meditation. So meditation literally is the act of surrendering to what is and simply being aware and listening to whatever happens for the time that you're spending in that meditative state. And when you start to do that and you start to relax, take a few deep breaths, you feel your body, you feel how you feel emotionally, what's going on with you that day, almost kind of like taking your internal temperature for that day. And as you feel yourself relaxing, you take a few deep breaths and relax. The first thing you're going to notice typically is your brain starts to think. And your brain may, of course, thinking all the whole time. And when I teach anyone meditation, initially I always say the first thought will be, what the hell am I doing here sitting meditating? I mean, what is the point? And so as the brain starts to think, thought to thought to thought to thought to thought, it's often like going to bed at night and going to sleep, where your brain is just kind of on cruise control. And oftentimes if there's a lot of anxiety, you don't fall asleep. You can't stop that process of obsessive compulsive brain thought patterns chasing its tail like a hamster in a cage. So in the meditative state, you allow that to happen. You're not trying to concentrate, you're not trying to focus, you allow your brain to chase its tail. And then when you find your brain and you get tired of watching the brain chasing its tail, you simply bring yourself to a center point. And with mindfulness meditation, the center is nothing more than feeling the rise and the fall of your chest as your body is breathing. And the beauty of this center point, this is a rhythm you're breathing. And we all have a different little variation on that rhythm, but we all have a specific rhythm. And listening and watching and being witness to the body's rhythm is very, very powerfully relaxing. Almost like being hypnotized and watching a watch swing back and forth. And meditation is often compared to hypnosis, and I honestly believe that the same kind of mental attitude and mental condition is evolving, whether you're being hypnotized or meditating. It's just someone else is doing it to you. Self-hypnosis is another type. Self-hypnosis is exactly the same. They say it's meditation in my mind. So as you sit with your breathing and you watch your body breathing, you feel kind of a sense of a center point. And initially what will happen is that you'll get an itch on your face and your attention will go to the itch off of your breathing. Or the garbage trucks will drive by and you'll listen to the garbage trucks. Or your brain will start to think, or your wife will walk across the room, or your little girl will run up and stand up at the chair and go, and stare at you, wondering what the hell you're doing. And so all of these things come into your experience in the 15 or 20 minutes that you're sitting there. And this isn't a distraction. This is the meditation. Everything that comes to your consciousness is part of the meditative state. So whatever happens in that 15 to 20 minutes, if you think the entire time and you never sit with your breathing and follow your breathing, that is your meditation. So the act of sitting and watching your body breathing, feeling the rise and fall of your chest, the way the air feels as it goes in your nose, and there's a pause, and then there's a temperature change, and the air comes out of your nose, and there's a pause. And there's a difference in the length of the in-breath and the length of the out-breath. But there's a rise and fall. Now, here's how I like to describe the transformative effect of meditation. This is a rhythm that you're experiencing. It's a natural rhythm. In the natural world, there are infinite number of rhythms going on every moment of every minute, every day, all the time. Your electrons are spinning around atomic particles, creating molecular structures that develop into proteins that will then cause nerve transmission and may cause a mental activity that may cause a sensation. And this is all happening in a rhythm. So I kind of equate those natural rhythms to the idea that there's a symphony going on all the time, but you can't hear it because we're not paying attention to it. We're not being quiet enough to recognize this symphony that's going on all the time. It's in me, it's in you, it's in the natural world. And it's literally, we could describe it in physical terms. You look at string theory and look at these energy packets vibrating at extremely high rates, creating what looks like mass. And then mass creating what looks like Larry and me and you and you and you, and the cabinet and the chairs. So this symphony is going on all the time, although it's not an auditory thing, it's a felt, it's something that you experience. And following your breathing is the only rhythm you have that will guide you as you deeply watch your body breathe into this symphony. It's as if you can only hear one instrument. But as you listen to that instrument, it opens up the entire symphony. And you start to see the state that occurs in your body all the time. You start to feel it. This isn't a thinking thing, by the way. This is a feeling. This is an experience. I often say, look, if I were to tell you that Argentina is a neat place to go, well, then go there and see if you like it. Well, it's the same with meditation. You can believe anything. You can be atheist, agnostic. This isn't about the brain function. In fact, this is about eventually letting the brain stop thinking. Eventually. Gaps in thought, where you sit in this state of just harmonic sense. And so that state of that symphony I've termed, for lack of a better term, harmonic resonance. So it's a resonant state of harmonic vibrations that's occurring in the natural world all the time, and we just don't experience it. So the idea is that as you follow your breathing, you follow it deeper and deeper and deeper and deeper and deeper into this state of surrendering. Again, the idea of surrender is very important because, for my mind, the seed of anxiety always comes from the need to be in control, or the perception that you have to be in control. And the more you feel like control is being taken from you, the more anxious you become. And so that idea that I need to, or the perception that I have to be in some kind of controlled state, is a very deep psychological need or attachment. And in the meditative state, you can control your breathing. You can breathe fast. It's a voluntary activity, but it happens all on its own. So the ability to let it happen on its own and not exercise control is the way you surrender, by letting go. Now your mind will say, I'm not breathing enough. Am I breathing too much? What's happening to me? The mind doesn't matter. Your body does this. You don't have to think about it. And that ability then, as you develop it, you stop thinking for periods of time. And the obsessive compulsive thinking disorder that we all have to greater or lesser degrees starts to dissipate slightly. Now apply that to someone with a drug and alcohol problem, or apply that to someone with anxiety and depression. You can instruct them that it is a part of their treatment program to learn impulse control and frustration tolerance. And as you meditate, that's exactly what you're doing. You're putting yourself in this contradistinction to your experience and to yourself. So this idea that consciousness sits all on its own, everything comes into your consciousness. Bathing in that conscious state with no thought, profound transformation. And it is absolutely, fantastically sensed. And the two things, I'll finish with the two things about meditation that I would leave you with. The first is that you cannot do it wrong. This isn't like I had one of my patients who is getting more and more into meditation as we talk, and he said, I always feel like I'm just snorkeling. I'm really not getting deep, you're just snorkeling. The fact is that is his meditation. That's where he's starting from. So, his concern about whether he's snorkeling or not, that's pointless. You do this without expectation because you cannot do it wrong, other than just not practicing. And the second thing is there is a natural gravitational pull, physiologic pull, to being in this state. And as you practice, you're driven gradually, slowly, inextricably toward this state of rhythmic being, where things are just happening without anyone at the control, without anyone trying to determine whether my sodium and potassium are coming in and out of my cells, and etc. So that's basically the short story of meditation and how I think that it applies to Sovereign and the program that we have here. And so and we have patients that we're teaching from early phases to start meditation, and the day-to-day life at Sovereign is that the first part of the patient's life is a meditative period of time. And then the last time before dinner is a meditative period of time. And people, have different relationships to what that means. So we're trying to encourage them to grasp or to let go of their concept and just do it.
How long do you recommend them to start this?
It depends on the person. One of my patients, who was a Sovereign patient, who was a 6'3", athletic, very, very energetic guy from, I think, Arkansas or somewhere. Meditation just didn't come into the conversation ever. Says that he can sit for 5 minutes. But after 5 minutes, he has to get up. And I've tried to encourage him that when you have that sensation of having to move, just feel it. Don't move. Let it come. Feel that energy of having to move. It'll dissipate out of you, almost like you're radiating stress. But in general, I recommend 15 minutes. The best, the practicality of meditation is that you want to wake up. So I usually recommend doing this first thing in the morning. So you get up out of bed, you take a shower, you brush your teeth, you get ready for the day, but then you put your pajamas back on and go sit in a comfortable place somewhere in your house, that you enjoy, where there won't be many distractions, and just sit. I recommend that you sit something like this. You don't have to be in the lotus position with your arms out or anything. You want as little physical contact as possible. So cross your ankles or fold your legs underneath you if that's comfortable, and then fold one hand inside the other and cross your thumbs with your hands in your lap. You don't want to be lying down when you do this because a lot of times you go to sleep. And the point isn't to go to sleep. The point is to stay awake. It's going to heighten your awareness of things. It doesn't lessen it. You don't go into a state of grogginess or mystical and disconnectedness. You go into a state of heightened awareness and everything around you. And so just to sit there like so, to close your eyes, to take a couple of deep breaths. You want to practice this with me? Sure. Now, let me just explain. Don't cross your fingers like this. And the only reason is there's a lot of touch going on when you do that. Fold your hands one inside the other. You want as little touch as possible. But whatever's comfortable. I have another patient who's quite obese, and she wants to sit with her hands apart. I said, that's fine. Sit with your hands apart. But you don't want your head relaxed back too much. You want your head unsupported, but your back well supported. So, take a deep breath in and close your eyes. And let all your air out. Take a second deep breath in. Hold your breath for a second. I want you to feel how you feel right now. Feel your body. Is there any tension? Let your air out. As you let your air out, let go of that tension. Take a deep breath in. Feel how you feel emotionally right now. What's going on with you? Sad, happy, anxious. Let that feeling come. And as you breathe out, let it pass through you. Let it wash over you. Let it go. Finally, take a deep breath in. Let your breath. Feel the room. Listen to the sound of the motor go. You're listening to my voice. Feel comfortable in it. As you breathe out, let your body sink into the environment, to the room around you. Now sit comfortably just for a second. I want you to bring your attention to the rise and fall of your chest. With each out breath, you're getting deeper and more relaxed. As you breathe in, your awareness is heightened. Out, let it go. Let go of your body. I want you to feel your hands. If there's any tension in your hands, let it go as you breathe out. I feel a heaviness in your hands. Feel your feet. Let go of all the tension in your feet. face. Feel the expression that you're holding and let go of. Let go of all the muscle tension in the face. Now let's open our eyes. Don't move for just a second. Just sit quietly. When you finish a state or an act of relaxing like that and you open your eyes, it's good just to sit and let the room and the environment and your kind of focused consciousness come back slowly, maybe a minute or two, rather than jumping up or moving immediately. Just sit quietly for another minute or two. It's very important that there's a gradual transition back from feeling that state of serenity or that state of relaxation. Did you have a sensation of relaxation now that you didn't have before when we started that?
Yes.
So I can always tell a difference, and you think it's common sense that you're going to, of course you're going to relax, you'll feel more relaxed, but if you practice this repeatedly, day after day after day after day after day after day after day, and you marinate in this state of relaxation, it starts to permeate your day. And so what was an aggravation to you last year no longer aggravates you. You recognize it, you know it's an aggravating thing, it just doesn't have the same impact. Things start to kind of be more funny, absurd. The preoccupations and the drama that we all carry into our lives just kind of drifts apart. And almost like smoke clearing or the fog clearing, it just starts to change, gradually, subtly change. This is not the quick fix. Everyone wants the quick fix, especially with our patients, but this is not the quick fix. This is a slow process. But it is something that patients can take with them. And if they see the value, they can practice this as a guide for the whole of their lives. This is a lifelong pursuit. And I think from me, it's the fundamental of transforming a person's life. And that practice just gets easier and easier and easier over time. So, that's it.
Thank you. Wonderful.
Thank you.